Our new hospital and emergency department will actually be opening this coming Sunday, March 6th. It's nearly 1 million square feet of clinical and support space on 53 acres. A 240-bed acute care hospital, which you see right behind me, all private rooms. A level 3 verified trauma center. A certified primary stroke center. 17 operating rooms with 1 hybrid operating room and 4 heart catheterization labs. An outpatient care center that houses our endoscopy center, Heart and Vascular Institute, and our joint Michigan State University McLaren Breast Imaging Center. The Karmanos Cancer Institute in partnership with MSU Healthcare. The McLaren Health and Wellness Pavilion, which actually will not open up till a month after we see our first patients here. During the course of this construction project, an estimated 2,500 construction jobs were created in the development of this campus.
Advancing our research and training in the next generation of caregivers to serve our patients in mid-Michigan and now beyond. This project alone has been in consideration in some form or another for nearly 2 decades, dating back to the early 2000s. McLaren Healthcare and Michigan State University have a rich tradition of partnership. Over the next several years, we hope to form a deeper bond with MSU, not only in Lansing, but throughout the McLaren system, which now spans assets in Michigan, Indiana, and the state of Ohio.
Community partnerships are really one of the key elements of MSU's medical education and healthcare delivery programs across the state of Michigan. We consider Michigan State University to be Michigan State University, and we want to partner with everyone we can to make a difference. But when we do something in our backyard, right in our backyard, literally adjacent to our campus, it's wonderful to have an amazing partner and a long-standing partner like McLaren to work with. So it's a very special partnership, and we really appreciate that. Having this new healthcare campus right next door is going to continue to build greater collaborations between the two of us. We can help build upon collaborative efforts to deliver education, conduct research, and engage with our community. And MSU is committed to building a healthier and better mid-Michigan, and I can't think of a better way to do this than this kind of partnership. So again, on behalf of MSU, we're very excited about what we're going to do. Since our founding 167 years ago, we've been interested in the health of the state of Michigan. It began really with our interest in nutrition and agriculture, but it's expanded now to many different dimensions, including, importantly, public health. And our partnerships in medicine, as I said before, are some of the most important ways we can make an impact in improving the health of people from Michigan. And this partnership, again, epitomizes it. As we pursue our vision for a new model of sustainable health, we're focused on every level of health, increasing access to health care, improving health outcomes for all groups. We're really concerned about disparities in healthcare provision. And so it's key to us that we get engaged in this kind of work in partnership with local systems to help integrate MSU directly into the communities we serve. It's absolutely vital. And this also helps build career pathways for our students. And we look forward to having MSU students work here and be a fundamental part of your caregiving team. Beyond the many benefits of improved health access and outcomes are the other things they do for our communities: improving quality of life, increasing their competitiveness as places to live, and producing a more vibrant economy. And all of those happen with the kind of collaborations we're talking about today. As a physician, I recognize the importance of our medical schools, College of Nursing, and clinical activities working together and with others. And I was really impressed by these facilities. I had a chance to tour it several weeks ago, and really amazed at the kind of state-of-the-art facilities that are going to be available, again, to all the citizens of Lansing, and beyond. And I'm really encouraged by what it means in McLaren's work with MSU. But there's someone who can talk about that a little better than I can. It's our Executive Vice President for the Health Sciences, Norm Beauchamp. Norm has been intimately involved in this partnership with McLaren. He's a radiologist. He's been involved in the collaborative work we're doing there in terms of the Institute. Spartan Radiology, how simple. How could I miss that? So Norm's been very actively involved in Spartan Radiology, and he'll talk more about this partnership. Again, I couldn't be more excited to be here. Thank you all for coming, and again, my congratulations to McLaren Lansing.
It's really a significant collaboration, and when I reflect on what this means to me, maybe I'll just share a personal story. My mother was a community mental health worker here in Lansing. And when she would talk about her work, she would emphasize community. She would say that in people's time of greatest need, being close to those you love, being supported, was so important to finding health. And I remember there were times when, in fact, the weather here in Michigan can be an impediment for people coming to the clinic, and she would work hard to get to them. Why? Because community matters and being close to those you love and support. And I would say that it's also the case that later in her life, when she was very ill, she had to leave the community to get too much of the care that she needed to get healthy. And I remember that just as clearly. And I know that I'm not alone in that experience. I think many of us know people that have to travel to get care, not in this community, but in every community. And then there's those individuals who can't afford to travel to get best access to care. And so why I think this is so significant is this is an incredible commitment to this community. And just some examples of what's coming together. We're going to create a number of service lines. One service line is for adult mental health. We'll work together in allowing people to participate in clinical trials in cancer. My colleague, Justin Clamaris, will comment on that, I'm certain. And then we also have created a facility that will allow for diagnosis of disease at its earliest times, which is Spartan Imaging and Spartan Radiology. Really proud of that. There's a long tradition of educating medical students here. I think there's over 50 medical students from the College of Osteopathic Medicine, 80 from the College of Nursing, and then statewide, all three colleges train students in McLaren facilities, and Phil touched a little bit on that. This is going to allow us to scale that up. And about 80% of our doctors that we train stay in state, and about 75% of our nurses stay in state. So this will be a magnet for bringing the best clinicians to the community to train, right, as well as to stay. So we're really excited about that. And then President Stanley touched on the MSU strategic plan. One of the focuses is transforming health. And so that will engage people from engineering, communications arts, natural sciences, the health colleges, working side by side with the amazing clinical work here to every single day figure out how can we do healthcare better and better and better. And that's really how health, hope, and healing happens. So I'm just really excited to be here, really proud to be partners with McLaren, and I'm just very thankful to the community for making this possible.
Today, as you have heard, we open our brand new 46,000-foot Karmanos Cancer Institute at McLaren Greater Lansing. As part of McLaren Healthcare, Karmanos has extended its reach far beyond where we were founded. It is in every community. Our goal is quite simple: to connect each patient to the full capability of a comprehensive cancer center. We extend clinical trials on every site. We link our physicians and cancer professionals together with integrated tumor boards, collaborative research, enhanced access to subspecialty surgeries, and the most robust radiation oncology program in the nation, with 12 radiation oncology centers, a gamma knife radiosurgery center in Farmington Hills, and one of the most advanced proton radiation centers in the world, located at Karmanos McLaren Flint. Today, Karmanos embarks on an exciting new collaboration and partnership with Michigan State University. The physicians, nurses, therapists, social workers, research associates, tumor registrars, students, and volunteers come under one roof today to fill the cancer center which we open. Buildings like this one are marvels. We have much to be proud of in the investments made to make this project come to fruition. However, the greatest capital will be the human capital that will fill it, comforting, preventing, healing, and leading patients and their families through their journeys with cancer. We thank McLaren CEO Phil Incarnati and President Samuel Stanley for aligning our organizations in this noble fight to defeat cancer. Phil, thank you for this major investment and our opportunity to partner in a deeper way in the community. As a graduate of the College of Human Medicine, I felt the call to serve our community. I moved back to Michigan from Baltimore, Maryland, because my Aunt Ruth was dying of pancreas cancer at a hospital in the Upper Peninsula of Michigan. And she had very limited access to care, as you shared as well, Norm. Her oncologist traveled once a week to the community to see her, and if the weather was bad or the schedule didn't allow, he didn't make it that one visit. This delayed her care and certainly compromised her outcome. Expanding access to cancer care for the people of Michigan and the partnerships we have built with Karmanos has been the most important work of my career, and our entire team's efforts are appreciated. We celebrate and enjoy this new partnership today. Thank you.
This health campus is not just awesome for all of the things that you've heard healthcare-wise, but it's transforming an important part of our city. McLaren came forward with an innovative plan that's going to be a catalyst for even more growth right here in Southeast Lansing. This investment that this campus brings will be a driving force for economic development here, and we've already seen that. We've got new housing, which is full. We have a new building which just opened up, and we had a ribbon cutting for that building. We're going to see more technology and innovation develop nearby with McLaren as the anchor for this growth. It's tremendously exciting. Our entire region is seeing growth like we've never seen before. There are so many incredible projects in the works all over that will be major economic drivers and provide thousands of jobs to our residents. We work closely with LEAP, the Lansing Economic Area Partnership. I saw Bob Trezise was here. We're really getting it done for this region. So I want to make sure that everyone knows this is just one part, but it's just an incredible part. One of the other jokes I'll tell is when we first started this, and Kirk talks about when we would sit outside, it was $400 million. And every time I'd see Kirk, he would up it by a little bit. So I wanted to meet with him as often as possible because every time it was a little bit more. And at the end, he said 600 million, and we said, great, 600 million. But just really thank you to Kirk, thank you to Phil. The investment in our city is incredible. It's an exciting time to be in Lansing, and this new hospital and healthcare campus is one of the gems of this incredible growth for our community. Lansing and McLaren Greater Lansing's time is now, and I'm thrilled to be with you and be a part of this incredible time in Lansing. I also want to thank MSU for their incredible partnership and investment. I get to do something which I don't often do, and many of you will know why, but I'm going to say, go green.
I just want to take this opportunity again to thank our speakers, all of the attendees today. A reminder that the hospital and our emergency room opens on March 6th, this coming Sunday. It'll be a day in history, a great day in history. And I can only tell you that this is probably, you only get to do this once in a lifetime. Some of us really only get a chance to do this once in a lifetime. And I'm very proud to be here today. I want to thank Phil again for the opportunity, more than anything, and the investment that McLaren Health has made in this community. And I think if you get an opportunity to walk around and see what we've brought to the community, the areas of respite, the aesthetics, the clinical innovation, all of those things that are going to be a new era in the beginning of healthcare for the region of Lansing for today and years beyond. Thank you all again for being here today. This is a great day for McLaren and the city of Lansing. Thank you.
I guess my first question is why Lansing in particular? You have so many other options throughout the country. Why here?
Sure. Well, we're delighted to be here. Of course, this is a enjoining of a new partnership, a new exciting partnership with Michigan State University, McLaren Greater Lansing, and Karmanos Cancer Institute. Karmanos is a part of McLaren Healthcare. We have 13 locations throughout Michigan. We had 2 locations here in the Lansing community. We're coming together now in this facility to offer the latest and greatest in our partnership between Michigan State, McLaren, and Karmanos. The 46,000 square foot building, the 25 exam rooms, 33 infusion bays, all of that is one thing, and it's exciting, but it's really the teams of people coming together to make a difference for people who are touched by cancer that is really exciting about today.